So I think one of the questions that was asked is, what are you trying to do to kind of get patients more engaged in the process? And I think patient engagement is quite important. We tried a lot of different things. I think for one is we created the environment within the site itself to be conducive to people just walking in. It's almost like a community center. But when they're coming in, people are getting exposed to the gym. So we put up a gym where people are exercising, there's nutritional classes, and that's become an avenue for where people are coming into a medical office for more the wellness, which is something I would have never thought. But in order to engage them is really providing a lot of different information. If they do decide to come to the medical practice, how do we engage them? We're using kiosks in terms of making sure that not only do we use the demographic information, make sure it's corrected, but we're using kiosks to get screening tools done at the point of contact. So it's almost that Disney experience. You're waiting, but at least we're getting the information we're going to need from you, keeping you occupied. And I think it helps us because that information gets translated in our system, and then our providers are really using it, and we don't find ourselves kind of writing something and then scanning it and then looking at it. It's all almost like the workflow is all put together. So that's key. The other sides that we found to be more engaging is really looking at social determinants of health. And I've always been doing this since 1996. So because we partner with Health Home GBUAHN, GBUAHN does transportation for its members. So patients can come in and go home and utilize that if they can't get a hold of their Medicaid transportation at any point. That is quite important because we use these transporting individuals as almost like they're concierge. They talk to them. Patients are often tell them a lot of different things that we may not know, and that actual transport, the person that's doing transportation will help get them in the system and say, by the way, we have this, we have that, and they give them a little information as to what we do in the system. The other pieces that we put together is we have apps. We have apps for the medical practice, for the accountable care, for GBUAHN, and the app really is really instrumental because once they sign into it, it's got a geofence, so when they're coming in, we can notify them about surveys. But within the apps there's buttons that they can push for transportation, for the health phones, for their providers that actually go into our call system. And so it becomes a little bit easier for the patient to not get lost in any tree, but really directly go to their provider or navigator, all from the point and click. A lot of instrumental stuff with learning, so if they have like patient education information, it's built into that app, plus many more in terms of providers, locations. I mean, these apps are they've gotten pretty amazing in terms of the amount of features that they can tie into the phone. So that's an avenue that we often use for some of the members to really do a better job.